Hello, hello, hello. So, welcome to the show, Victor. I'm so glad to have you here to discuss Ayurveda today.
Thanks, Jen. Appreciate you having me on.
Yeah. So, as an Ayurvedic doctor, can you just explain your path and what brought you into this field and help us understand exactly why, what is Ayurveda and why is it so unique and special and helpful for most people to incorporate into their healthy lifestyle?
Yeah, so I got into Ayurveda to achieve better health, and I didn't know it at the time when I was in my early 20s, but it's the sister science of yoga. And so, yoga got very popular in the West very fast. And it's become something of its kind of own in the West. But what it's not paired with so oftenly is Ayurveda. Ayurveda is just now coming into vogue in the United States. But thousands of years ago, yoga and Ayurveda were practiced together always. Because Ayurveda, the lifestyle of Ayurveda that Ayurveda supports, is conducive to a yoga practice. So it's conducive to attaining spiritual heights in oneself. A healthy body is necessary to kind of get to the deeper aspects of our being. And that's what yoga's aim is. So Ayurveda is very special in the context of yoga in that way. And it's even outside the context of yoga, it's a complete health system. So it's holistic in nature, meaning that we address the entire being, not just a specific part of the body at any given moment. And that's very different from what we think of as modern medicine, which is very symptom centric. Ayurveda is cause centric. We always want to find the cause and the cause of why some issues happening in the body or the mind. And those causes are found in dietary habits. They're found in behavior. They're found in lifestyle choices. They're found in emotional patterns, and they're found in spiritual challenges. So I encourage people listening to take that very seriously. That's not meant as a metaphor or as a device to, be poetic. Oftentimes, very real diseases are manifested from very real spiritual conflicts or emotional conflicts. And those are the major contributing causes. And so Ayurveda addresses all of those all at once.
Yeah, I really love that. And one of the reasons I started the podcast as a traditional MD is because we are divisive. And, what I find is on the skin is not really a skin related condition very frequently. It may be immune related or something psychiatric, like anxiety can present with all sorts of dermatitis and, many, many other things. So I want to dive a little bit into, well, actually, I have a two-part question. The first part is, functional medicine doctors will often talk about root cause. So, how would you differentiate functional medicine with Ayurveda?
Definitely use different techniques, diagnostic techniques, so on and so forth. And, these days there are so many healing modalities out there, and they all have a bit of a different scope and preferences on what tools that they use. But functional medicine is approaching the heart of Ayurveda, or I should say they share the same heart, where they're holistic in nature. And that's really getting to, functional medicine came a long time after Ayurvedic medicine. So Ayurvedic medicine's been around for 5,000 to 7,000 years. Chinese medicine, a little less, but around the same time, And those two, Chinese medicine and Ayurvedic medicine, are kind of the parents of all the other holistic modalities out there
Mm.
today.
So do you think because there are all these other components, dietary, behavior, lifestyle, emotional, spiritual, and I think we live in a society where I feel like people often will want to hand over their issues and expect a solution with a pill or a one fix remedy. And you see that with diet things all the time. There's all these diet plans out there because, it's like just have grapefruits and you'll be fine, or
Yeah,
just
right.
keep it
Yeah.
simple. But it's never it's never really that simple because, as you had mentioned, there's a lot of emotional and spiritual things that you kind of have to reflect and look into yourself on a deeper level, which sometimes it may be challenging to face. So what are some themes that you see? Because I kind of believe, which some of my MD counterparts might not want to hear this, but I believe things like cancer come from um, emotional states of in different experiences, whether you hold things in, or you have anger or other things. So I think that would tie into what you're saying about Ayurveda, or am I off base here?
Oh, no, completely. So let's take just a simple example, right? Or I guess it's not so simple, but common example. Let's say you get a young kid, 6, 7 years old, right? And they live in a household where the um, father is just full of rage and anger, and the mother is very submissive to that, right?
Oh, this would be me. Okay.
Okay, I didn't know that, but sure, let's do that, right? It's
Okay.
common, it's common,
Yeah.
right?
This is little Jen 30 years ago. Okay.
Okay, so you have a really unhealthy dynamic. Now, it's not a coincidence that that dynamic's called unhealthy, right? So, but let's walk through it from like an Ayurvedic lens. So that child is going to most certainly feel angry and most certainly feel alone and unprotected, mainly, right? So they're scared. The child's scared and threatened is the key word there. The child does not have a safe environment. And if the body does not have a safe environment to grow in, then it doesn't develop properly. That's all because of the autonomic nervous system, the vagus nerve, parasympathetic, sympathetic nervous system. They all operate like that, right? So right there, immediately you have a mind-body connection that's been known about for thousands of years. And so now any emotional state that that child experiences is going to directly translate into the vital organs through the autonomic nervous system. So that child has physical consequences for the experience of threat, loneliness, detachment, all those things. Now, that child's body is going to adapt. It's not just going to sit there and do nothing. It's going to adapt to the situation and create some kind of defense against that. So maybe the child goes, when the dad's raging, the child goes into their room and locks the door. Maybe the child tries to fight the father, even though you can't win. Maybe the child tries to protect the mother. Whatever. There are 1,000 different adaptations, right? But that body is changing its physiology in order to adapt to the situation. And now what happens typically is that the child's left with a feeling of being unloved, unsupported, and alone. That's the key. And right now we're experiencing that a lot with COVID. Everyone feels alone.
Yeah.
That leaves a feeling, a very, very, very real feeling inside that child's body. So that means neurons are firing, right? Constantly. And the child, that's suffering, there's pain involved in that loneliness and isolation. We as human beings are not built to live in isolation, neurobiologically speaking. So that the body experiences that as suffering, and the child seeks relief from that suffering. And so now they feel better when they have a giant candy bar. And they feel better for 10 minutes, right? They get that rush, and all of a sudden, they're not suffering so much. But then after a little while, or another event happens, and the child's reminded that they're suffering, right? They're really alone and isolated and threatened. And so what do? They go and eat a big bowl of ice cream, and they feel better, right? And that cycle continues and continues and continues. And before you know it, you have a kid with an eating disorder, right? Or the mom notices this and doesn't want her child to be in pain, so she starts feeding her child a bunch of junk food,
Mm,
right? You know, and whenever the child learns that whenever they get distressed, they can comfort themselves with food. So that's an eating disorder. That's an addiction,
or
right?
whatever they decide. Like how is it
Or
determined?
marijuana,
Yeah, or
or alcohol, or attachment to other
overachievement.
people, or sex, or overachievement, or whatever helps keep their environment semi-safe, as safe as
Mm,
they can possibly make it. Maybe my dad isn't raging if I get straight A's, right?
interesting.
So that child's doing that, and that is having a massive effect on their body, massive, huge, right? Not only is the actual feeling having a massive effect on the body, but the patterns and habits that they adopt to compensate for the emptiness is having a massive effect on the body. Now, tell me what pill you can prescribe to heal loneliness.
Yeah.
There is none. You can say whatever, Ritalin or Adderall or whatever they are, Zoloft, whatever. That does not heal loneliness. It just does the same thing that eating a bowl of ice cream does.
So
It makes
really,
you
if
feel
someone,
better
oh,
for a little
yeah,
bit.
so if someone comes
Yeah.
in and they have some sort of a, I mean, what are some of the common issues someone might come in for? Obviously, if they're discussing weight loss, you get to the root of, well, why are you having a difficult time, maintaining a healthy weight? Is it, your paradigm needs to be shifted, that you're not an athlete? Is it some sort of a every night you want to eat that cake because it self-soothes you? And that's really what you're getting at here. But what if someone thinks what they're doing is kind of effective? Like, oh, I'm a high achiever. I don't seem to be able to have good relationships. They're probably not seeing an Ayurvedic doctor. They're going to see a therapist. So, at what point do people who maybe don't have physical ailments, yet they may have challenges in relationships, whether it's conflicts at work or romance or friendships and like high drama states, at what point do they take a step back and say, hey, this is no longer serving me? And how do they use Ayurveda to um, kind of work through that? Because it seems like that would come up quite frequently and this would be
All the
helpful.
time. Yeah,
Yeah.
almost everyone, right? So,
Yeah.
I mean, a few things there, right? One is, remember, during the days where Ayurveda was cultivated, there wasn't such a thing called a therapist. If you had this kind of problem, you would go to the healer in the village, and that would be the Ayurvedic or Chinese, whatever, right? So those fields were married, and that's what it means to be holistic. It's like, oh, I'm going to look at you. I'm not just going to say, oh, there's a rash. Here's a steroid cream. Now go talk to a therapist. That's not going to
Yeah.
happen, right? In an Ayurvedic context or in original how it was originally cultivated, for a reason. The reason is you want to address those things and see them as the same problem. You don't want to compartmentalize your skin issue here and your relationship issues here, because they're part of the same pathology. So it's actually an unhealthy habit to compartmentalize like that in and of
Mhm.
itself. It's not, you're not seeing the truth of yourself as a being, right? And the other thing is, so that's kind of an invention of modern medicine, but modern medicine is very new. It's very young, right? It has not been around a very long time in comparison to these other modalities. Um, and it has incredible technology, but that doesn't mean it answers all the questions. So there are
And
challenges there. Yeah.
yeah, and there's a state of mind and a mindset that almost has to be adjusted, which is why I like having these conversations. Because I mean, frequently over the last 18 years that I've been a dermatologist, I see people with we call them prurigo nodules or picker's nodules, or this obsessive kind of picking that's going on. And we know that there's something going on anxiety wise, whether whatever it may be, which obviously an Ayurvedic doctor can help get to the root cause of that. But there's a stigma often if I say, well, you should see a psychiatrist too to discuss this. There's an offensive part of it. And I think you kind of hit it on the nail on the head when you said, you kind of have to really reflect and and realize like we're all human. We all have some sort of issue, all of us. And it may manifest in different areas of our lives. So in order to rise up those areas of our life, we have to take a look within.
Yeah, it's unfortunate that there's a stigma attached to it. There really shouldn't be.
There really
Because
shouldn't
like you
be,
said, everyone's experiencing these things. It's just part of being alive.
right?
And I think part of the stigma is created because of this compartmentalization.
Mm-hmm.
When really it's like, oh, someone should be saying, oh, you're right, thank you. Like I need to talk to someone. I'm having a hard time with these things, right? And it's
Yeah.
manifesting in my skin. And I know that when I eat, or let's say when I drink a bunch of coffee, it gets worse, right? And why am I drinking a bunch of coffee? And then you can trace it all the way back to that root cause.
Mm-hmm.
And it's going to be something psychosomatic every time. It has to be, because we can't detach our mind from our body. That's a ridiculous concept to begin with.
So how does Ayurveda view something like autism?
Autism is considered a vata disorder,
Okay.
and it happens. It's got a genetic component. So Ayurveda acknowledges that, but it also acknowledges, well, why, right? Why did how well did the mother take care of herself, and how much stress was she under, and what are her genetics like, and da da da, and on, because you know I don't know how many years ago, but it used to be, oh, the story is, oh, you have your genetics and that's it. But that wasn't true, right? And now it's epigenetics, and what's
Yeah.
it going to be next week, right? So if you go way back to the older traditions, they never thought that it was just, oh, genetics, that's it. It was acknowledged that, oh, there are these things that are passed down through lineages, but what are all the factors involved in creating this issue that we see in this child, right? And it's not a judgment. It doesn't mean that, oh, the mom's evil or did something wrong, or
Yeah.
it's just like, let's look at what is it so we can resolve it. Like, let's find out what's causing all of this.
Because it could be
So,
different for every person. Like my son was
right,
diagnosed with autism 15, 14, about 13 years ago. And we did some we did some neurofeedback, and I pulled out artificial chemicals out of the diet and gave him some supplements, and he doesn't have any sign, and I didn't label him,
right.
and it wasn't severe. I can't speak for everyone out there, and I certainly can't give anyone medical advice because it's such a personalized thing, where I have some other friends who went through similar diagnoses and those things didn't work for them. So yeah, and I was stressed when I was pregnant, and I was,
Sure,
all
of
the other
course.
things. So yeah, it's multifactorial. So what does Ayurveda think about like transgenerational trauma, like that kind of thing?
Oh, absolutely. I mean, that's the thing. So we have a cool word these days, transgenerational trauma,
Yeah.
right?
I was kind
So
of debating on what to call it.
no, that's perfect. I just watched
Okay.
this wonderful talk yesterday from a neuroscientist from NYU. She's actually a personal friend of mine, and she did a whole giant study on oxytocin, and how basically she took her conclusions and said, this is how transgenerational trauma happens, through some of these neuroreceptors and stuff like that, right? So in Sanskrit terminology,
Wait,
what would they have
explain
called
that.
it?
Can you explain that?
Yeah. So I'll try and get her experiment right. Please forgive me.
Okay.
I'm not a
Yes.
neuroscientist. So,
We'll give
okay.
you
Her name
grace.
is Bianca Jones Marlin, right? And she has a lab called the Marlin Lab. And she started out studying oxytocin. And what she found out is that humans have a lateralized receptor base in the left auditory matrix. Okay. Only the left, not the right. There are some oxytocin receptors in the right, but there are 2 times more on the left. And so with mice, when a baby mouse would cry out, right? In the mother, oxytocin would be released, right, through those channels, and then the mother would go and retrieve the baby. In a non-mother mouse, the mother would really not retrieve the baby, right? Most of the time. Sorry, not the mother, the virgin would not retrieve the baby. So there was something that was going on with oxytocin when, after a mother gave birth, all this oxytocin would be released. And now she had a behavior that was attached to the cry of the baby. And that was going on through the left part of the brain area, right? So the experiment was, you give the virgin mice who had never given birth oxytocin injections in that area. And they do. Most of them would start acting like a mother, right? Even though they'd never given birth. So that was her big finding. And it was like, okay, so this is where it's happening, at least in that. And all your senses are connected to oxytocin, but she was focusing on that. So then she did studies and in partnership with other people who are studying epigenetics of basically how these similar receptors modify the sperm and ovum after traumatic experiences so that actually the baby inherits something that was learned by the parents is actually inherited by the baby. And I don't attempt to even explain it. Like I said, I'm not a neuroscientist. She did all this stuff that basically shows that path, right?
Interesting. Yeah.
And how that happens. So it's very real. But here's the thing. Ayurveda, 7,000 years ago, right? They didn't call it transgenerational trauma. They called it ancestral karma. The same thing. It's the exact same thing, just a Sanskrit term for it.
Yeah.
So it was acknowledged. It was known. It's not new, but it's very real.
And that can be worked through.
That's the point.
Yeah.
Right? Is that you can change these things inside you to an extent, or if not completely. And that's when the work of healing begins. And that's where Ayurveda really gets down and dirty with it. And that's why it's not just symptom healing. It's like, no, we're gonna work on the causes. And it's gonna be hard because people protect their defense mechanisms, right? If I have an adaptation that saved my butt when I was 6 years old, and I've never done any work around it, right? And it's so buried in my nervous system that when it comes up, I just automatically react. And if someone tries to get me to drop the thing that protected me, you can forget about it. I'm going to feel vulnerable. I'll feel weak. I'll feel like the world can hurt me now. So there's so much stuff to do around all that. It's not easy. And that's why a lot of people just say, I don't want to do it. I'll just take the pill.
Yeah, it's so true. I did a week at 40 Years of Zen, which is an intensive neurofeedback center in Seattle with Dr. Drew Pearson. And Dave Asprey owns the place, but Dr. Drew Pearson is the neuroscientist that runs it. And it's a combination of neurofeedback, and you kind of go in these little groups afterwards where you have to do resets on these memories you have as a child. And people would say, well, that's really not important. And the facilitators say, well, out of the millions of memories that you could have, you have that one for a reason, right? Did you remember what you ate for breakfast that same day? No, you don't, but you remember that experience and that interaction. So I personally have felt what you're discussing during that experience where, like we do have certain mechanisms and coping mechanisms and strategies that had worked in the past, and they no longer serve you. And there actually can be deterrents to, accomplishing what you want or connecting with people in the way that you want now. So it's a lot of work. And I understand what you're saying. And I hope that the audience is resonating with this. And it all starts with recognition. So I do want to get into some of the diagnostic things that you do and how they're unique. Can you discuss some of that?
Yeah. So Ayurveda has a few diagnostic techniques that are quite unique. One of them, probably the most famous one in Ayurveda, is pulse reading, which has a long history. And it's not like a pulse reading, like you don't put your two fingers on the carotid artery and say, like, okay, how many beats per minute, right? So that's important, obviously. We need to know that. But pulse reading with Ayurveda actually takes the form of placing 3 fingers on the radial artery, which is below the thumb on the wrist, and you read the pulse that way, right? And each finger is monitoring the rate, the rhythm, like we're used to, but also in the temperature of the skin, the strength of the pulse, right? And the gait, so how it moves in specific patterns across the finger. But not only that, then you do 7 layers. So by compressing that artery at different degrees, you achieve different layers, in quotes, of the pulse, right? And then based on each layer, you get different information. So you can read the status of the constitution, the overall imbalances. You can read messages from the different organs. You can read messages of what are called from the different subdoshas. That's an Ayurvedic term. You can read the quality of each layer of tissue. So like blood, bone, nerve, all that, on and on and on, and more. But it's a very sophisticated system of measuring what's going on inside the human body. And it takes a lot of practice to
Yeah,
get
I
good at
bet.
that. Yeah.
I bet. So so obviously you have to do in-person consultations.
Yeah. For the pulse
Yeah.
reading, you need to be in person. And, but one thing you can do over Zoom is tongue diagnosis. And that's
Mhm.
very, very common in Chinese medicine too. Oh, you're looking pretty clean.
Do I look clean? Okay, I'm sticking out
Yeah.
my tongue for those of you that aren't watching.
Yeah. And, you can tell a lot about the body on the tongue. You just shape, the size, the color, obviously, but where the cracks are in the tongue, how the tongue responds when you touch it, the feel, what am I thinking of? The
The
density, the elasticity.
elasticity. Yeah.
Yes, the elasticity, all that stuff. Where the coating is, what color the coating is, what the veins look like on the bottom of the tongue, all that. And then you cross-reference all these modalities. We look in the eyes, we look up the nose, like you would do if you remember going to the pediatrician, right?
Of
They would
course.
check out all those things. So those all came from ancient healing traditions. Those techniques have been around for a long time.
But with more
And
information, a lot of information, it's interesting. It's been lost. I
yeah,
wasn't
and
taught
palpation,
anything.
right?
Yeah.
Yeah,
Hmm.
palpation of the abdomen is another
Yeah.
huge diagnostic technique. And it's a shame. I was just reading in a book about diagnostics that basically, we have these insanely complex machines these days, and they're great. They can read all these things, right? But you still need a person who knows what it means interpreting it. And that's the art of diagnosis, really.
Yeah. And
Is
also the power of touch. I think there's so much more
Yeah.
to it than we can't even really measure in scientific terms, but it's a healing modality of human touch and this innate sense that those of us that are healers have without really being able to calculate it.
Right, absolutely. I mean, those diagnostic techniques that rely on touch and the intimacy between the rogi, they're called in Ayurveda, or patient, and the doctor, are woven into the fabric of the healing relationship. And that's
Mhm.
something that you can't just ignore. And any healer of any modality knows the value of that and witnesses the value of that firsthand.
Right.
So yeah.
I had a patient years ago and I had seen him for skin checks for, I don't know, 2 or 3 years and every 3 months. And one day I saw him and he walked through the room and I didn't even touch him. I just kind of felt his energy. I said, "You're sick." He's like, what are you saying? I didn't even have a skin check yet. I said, I can't explain it. I just feel that you're sick. And he had a kidney failure and he ended up getting a kidney transplant once we checked the blood work. But it's something that I think is this connection that we have with other humans that allows us to do things that computers and technology can't quite do. And that's why the pulse diagnosis is so fascinating to me, that you can note all of those things. So can you explain some of the things that you see commonly nowadays by feeling the pulse? Are there like 5 common things that you see with the different states or conditions that you were discussing?
Oh yeah. I mean, these days, diabetes is huge. Um, weight issues, but what weight issues come down to is a metabolic issue, right? So metabolic issues, lots of IBS, Crohn's, things like that. And they can all be picked up in the pulse. And if you know how to read a pulse, then it's not easy, but it's not hard. You can find them if you know what you're looking for. And, with Ayurveda doesn't actually do disease classification the way that Western medicine does. So Ayurveda is much more interested in how the disease came to be and that path, because you can have the same presenting symptoms, but a completely different pathology.
Yes,
So
exactly.
those are going to
Okay.
require different different methods of healing. And that's what an Ayurvedic physician is trained in. It's like, don't get wrapped up in the fact that this person has hyperacidity. It's why is there hyperacidity? Because 2 different people or 5 different people, 5 different reasons for the hyperacidity. Right. So they're going to get a completely different diet. They're going to get a completely different herbal formula from each other, even though they have the same symptom.
Okay. So let's talk about like just overweight, right? Or obesity.
Yeah.
What are some of the things various different things that you often see?
In pulse or just in general?
Let's talk about pulse. Yeah.
Okay. So typically their pulse will have like a heavy, dull thud to it.
Okay.
And that's always just a easy thing to feel, indication of a lot of toxicity in the system. But then if you dig deeper, then the pulse will narrow out frequently. And that's an indication of their deep core anxieties going on. And it also depends on their constitution, right? Ayurveda
what do you
talks
mean?
about
Yeah, let's talk.
Yeah.
Okay, so the toxicity, is the toxicity a result of eating poor food or the cause of the obesity? And that's what you kind of have to dig into.
All of it.
Yeah. Okay. So let's talk about the what did you just call it? The constitution?
Constitution.
Okay, talk about those a little bit because you mentioned vata, I think, earlier.
Yeah. So
Okay.
Ayurveda talks about what's called 3 doshas.
Okay.
And those are fundamental biological forces in nature. And all living things have them.
I think I have heat.
The tree has it. Yeah. The human has it. The rabbit has it. The dog has it. Everyone. Okay. So they're like, essences or basics, foundational, right? And they all have different kind of prominent features or qualities. So vata controls everything that moves. If it moves, it's vata's the force behind that movement.
Okay.
Pitta controls everything that changes from one state to another. So like chemistry, so like acids and alkalines and all that stuff, the breakdown of gross matter into its component parts and then their reassemblance chemically into a new thing. That's pitta. Then
okay.
kapha deals with everything that grows or increases itself. So like, cell adherence to each other, forming a bigger structure, right?
What was the last one? There's vata, pitta, and then I didn't hear the last
kapha.
One. Kapha, K-A.
P-H-A.
P-H-A, okay.
And everyone has all 3.
Okay.
And every part of your body has all 3, but in different proportions. And so everyone's born with a unique recipe of these 3 and how they function inside the body. That unique recipe creates your constitution. It's called prakruti, is a Sanskrit term.
Okay.
And based on that, you're going to get treated differently.
And that will never change.
It is the way it is when you're born, and it never changes. But you can fall out of balance with your own prakruti. And that is when illness manifests. So if I am born pitta, I typically will have a medium frame, medium weight, medium everything. That's just the nature of it. I won't get into why. It'll take us 4 hours to explain it. And then let's say I develop some kind of imbalance and I gain 80 pounds, right? Now I have what's called a kapha imbalance, right? So I now have a predominance of kapha in my system, but I'm not supposed to. But the same person who weighs as much as I do now with my overweight factor, who is naturally a kapha constitution, that's their natural weight. They shouldn't be any skinnier. If they were to lose 80 pounds, they would get sick, right? So every health is determined in the context of your constitution. That's the important principle.
So is that kind of what you determine first, what somebody's constitution is before you? Okay.
Ideally, yeah.
Yeah. Okay.
Right.
And then how about the tongue? So I think my tongue changes every day.
The tongue changes quite frequently.
Okay.
Yeah. And it's a measure of what's going on in real time inside your body.
Inside your gut or everywhere?
Everywhere.
If I was really stressed and this interview, would my tongue change?
I mean, probably not in a super noticeable way, but if you experience chronic stress, it would.
Okay.
Yeah.
Okay. And then how quickly can people respond to some of the treatments
Ayurvedic
with their
treatment.
tongue? Yeah.
Oh, the tongue, the tongue's kind of like,
An acute
no,
thing.
no, the like coating on the tongue can change day to day, but like
Okay.
cracks or discolorations in the tongue, that can take months.
Okay.
Yeah.
Okay. So I'm looking behind you at all those jars. So are those
Yeah.
some of the herbs that you use?
Yes, that is just for display, but it's some of the Ayurvedic herbs that I commonly use.
Okay. So there's a lot, adaptogens have been discussed a lot in the last year. Is that aligned with Ayurveda, or is that something different? Like, is that where they derive from?
Yeah, I mean, of course. So there's volumes and volumes of texts on these herbs, right? And all
Hmm.
their uses and what you can combine them with and what not to combine them with. And the word adaptogen is such a limiting word. It
Yeah.
captures only a specific part of an herb, like ashwagandha, right? Which
Yeah.
is
I
a
know
very,
everyone loves ashwagandha right now.
yeah, it's a very famous Ayurvedic herb and has been used for thousands of years in very specific ways. The tragedy of all this is that most people should not be taking ashwagandha. It is negative, right? I know it's an adaptogen, I know, but the fact of the matter is, if your body doesn't digest it properly, you don't get the benefit of it, regardless of what's in the herb, right?
Yeah.
And ashwagandha is heavy, it's hard to digest. And so most people who have digestive issues are taking ashwagandha and it's just becoming a toxin in their body. It's not helping them, or it's only helping them to a very minor degree in a very specific way, and they have a much deeper problem that they need to resolve, right? So unfortunately, these herbs get marketed in such a way so that some people can make a lot of money. And so they say, adaptogen, male potency, and there you go. You have half the population in the United States running off and taking ashwagandha. And guess what? It's natural, which makes it automatically okay or something. I don't know.
Like poison
So
ivy or arsenic. Yeah.
yeah, right. Both natural things that can do some serious harm. So, it's so sad for me to see that whole mentality racing through the Ayurvedic um, herbs, because that mentality goes into flies in the face of the Ayurvedic philosophy.
Yeah, I'm really glad you brought that up because it goes back to what we were saying earlier about people wanting like a one solution for everything. And they're really are there any herbs you think everyone should be taking, or are you saying that it's just very personalized, and even the right herb in the wrong proportion can be harmful if it's not titrated properly?
Right. It's very, very personal. I mean, yes, of course, there are some herbs like culinary spices that, are pretty almost universally safe, right? But even then, I get people all the time where I'll say, don't eat that spice. I'll tell people to stop taking turmeric, things like that. Like if you have a pitta aggravation, you should not take a lot of turmeric
Okay.
unless it's a very, then we get into all the nitty gritty and details, which I'm not going to get into, right? But when you're speaking in broad strokes, no, there's a famous axiom in Ayurveda. Everything in nature is either a poison or a medicine, depending on the context of which it's used.
Very
That's
true.
that's the gem in Ayurveda. So everything's either a medicine or a poison.
Yeah, that's huge. So I know, how does it work as an Ayurvedic doctor? Because I know people will want to seek your help and work with you when they're listening to the podcast. Is it like us where you have to be licensed in their state, or can people reach you on your website, or how can they, you know, get more
It is
personalized care?
Yeah, Ayurveda is not licensed in the United States, and I'm actually quite thankful about that,
Right.
because yeah,
As
but
long
it
as it's
is
not abused. So there's got to be some
exactly
sort of place
right,
to find the
right.
right
So
person.
that's always the tightrope walk of licensure, right? Is that on the one hand, you could get people who don't respect the art and abuse the rules, right? But on the
Mhm.
other hand, licensure can be very constricting and all that stuff. So, anyways, we're not talking about that.
No, I
The
want to talk about that, Victor. No, I'm just kidding.
Okay, yeah,
No,
yeah.
I'm kidding. I do not. I
I'm
do
happy to
not.
talk about it.
No.
But yes, the idea is you want to find someone very trained, right? So don't just find someone who's done a weekend course in Ayurveda. Um, if you got a serious something going on, right, and you want to work with someone seriously. Um, for general lifestyle suggestions, it's fine. But so you find someone who's professionally trained, And then you just call. Like, I'm easy to access. There are a lot of practitioners in California, and that's it. You just schedule an appointment, and these days a lot of that stuff's done on Zoom.
And you're based out of California?
I'm in Northern California.
Okay. Okay. So, I mean, we'll have all of your links in the show notes, obviously your website. And then do you do anything on Instagram or social media or anything like that?
I don't do social media.
Yeah. It's
Yeah.
probably smart, especially because it's so personalized. So if you start saying something, I mean, everyone wants to jump on the ashwagandha bandwagon and then start doing that. So I think it's great. I'm going to take a look at all of my supplements and make sure I'm not overdoing ashwagandha
Yeah,
myself
for
because
sure.
I think it's actually in one of my hair supplements. I think they have like an adaptogen complex. So it's really, really interesting. And gosh, I'd love to work with you. I'd really love to work with you. So are there any other like tips or advice and generalizations that you can make coming from an Ayurvedic standpoint before we close up here?
Yeah, I mean, there are definitely a few universal things. One tip I love to give the world, I would tell the whole world if I could. Seriously, if you can get your meal timing down properly, that can sometimes be the most single biggest factor in feeling better and healing.
What do you mean by that? Because I know like I'm naturally most hungry between 1 and 3 p.m.
Right. So that
Doesn't
and
work
all
socially.
that stuff is trained. That's what we need to understand. So human beings in general have a circadian rhythm, and it responds to light. It's the sun moon cycle, basically, right? And so if we were living very close to nature, which would be much better for our health, but these days we're not. So if we're living very close to nature, you would be in that circadian rhythm. You wouldn't have much of a choice, right? But
And
these days,
women even would cycle with the moon.
yeah, absolutely,
Mhm.
completely, right? So that circadian rhythm is what our body is meant to uphold, and it operates best and most efficiently when it's following that rhythm. So that means, if Ayurvedically speaking, you should eat 2 meals a day, and it should either be a light breakfast and a heavy lunch, or a heavy lunch and a light dinner, depending on who you are and what you do and all that stuff. If you can not eat after 6 p.m., have your lunch at 12. Lunch is your biggest meal of the day. You can do a lot with just that.
I agree. I'm like a 10 a.m., 3 p.m. person, and it works really well.
3 p.m. is too late for lunch.
That's my second meal. Yeah.
Oh, that's true. You could do that. So
Yeah.
if I were working with you, I'd shift it to like 11 and 4, and then you'd be perfect.
Yeah. Okay.
But
That's all I need to hear. Okay, so that's one universal. So get your food timing down, light one meal, breakfast or dinner, and then larger
heavy,
meal for lunch.
heavy lunch. Yeah. That's
Okay.
when your metabolism's naturally highest. Now, if you've beat up your circadian rhythm over the years and it's all off, right? So like, you eat dinner at 10 p.m. and, whatever it is, then it takes some work to bring it back to that normal cycle. So you may not always work out great to just immediately jump, you want to work it over time. But in the end, if you can get it there, that's where you're going to
Yes.
benefit from that. Yeah.
Socially, it's hard. I get picked on sometimes when I try to get everyone to eat dinner at 5 and we go out to a restaurant and they're joking like, okay, this is a great brunch. When are we going to have dinner? In a few hours.
Right.
European friends, of course, So,
European.
but I know it makes me feel good. So, that's really good advice for the listeners to realize, and just reflect on and become in tune with their bodies. Okay. Any other universal advice?
Drink hot water.
Really? Hot
Yeah.
water.
Yeah.
You realize it's 110 here in Arizona right now.
Yeah. So then room temperature water will be fine. Yeah.
With lemon, or does that not matter?
No, I do it without lemon.
Okay.
Only
Okay.
certain constitutions should have lemon.
Okay. Good. I don't like it. It doesn't do me well.
Yeah.
Okay. So why hot water?
It helps purify your whole GI tract on a very mild basis. But if you make it a habit, then it's like a constant cleanse, mild cleanse, right?
Wow, that's
Yeah.
great. I only do it when I'm skiing to stay warm. So I like that. That's really good. Just sip on hot water.
Yep. Just sip on it. No need to chug it. You don't need to drink 4 gallons of water every day, just throughout
Yeah.
the day. If you can get a liter of hot water in, you're good.
Excellent. I love that. Oh, Victor, thank you so much. Okay, so before we close out, I have one question I ask everyone. How do you define radiance from an Ayurvedic or personal perspective?
Radiance. Oh, that's a good question. Okay. How would I define radiance? I would say radiance is the authentic connection to the soul that pervades through every tissue of your body.
That may be the winning answer.
That was
Because
good.
yeah, it's your truth. So I like that. I like that a lot. Thank you so much. I really, really loved having you on. We'll have all of your information in the show notes, and I'm very grateful for your time.
Thank you so much. I appreciate it. That was great. Thank you.